So can nutritional deficiencies be linked to a child's behavior? Well, yes. So the simple truth is, you are what you eat. You are what you assimilate. The food a growing child eats directly impacts their behavior and physical and psychological profile, though children often crave foods that are high in sugar. Symptoms of nutritional deficiency in children: bedwetting, persistent colds or infections, allergies, wheezing, stuffy noses and sweating, hyperactivity, irritability, twitching and restlessness, digestive issues like constipation, diarrhea and stomach aches, fatigue, poor attention span and difficulty in school, eating non-food items like stones, hair, or ice, also known as pica, poor growth. So let's look at this again. Bedwetting, which, if you know anything about criminology, has been linked to criminal behavior. Persisting colds or infections, allergies, wheezing, stuffy noses, sweating, hyperactivity, irritability, twitching, and restlessness, also sometimes called ADHD, digestive issues like constipation, diarrhea, and stomach aches, fatigue, depression, fibromyalgia, etc., poor attention span and difficulty in school, ADHD, eating non-food items like stones, hair, or ice, also known as pica or pica, and poor growth. Now, before I continue, I want to remind people I'm not a physician. I'm not an MD. I'm not a DO. I'm not an ND. I'm not a chiropractor. I'm not a nurse. I'm not an LPN. I'm not an RN. I'm not a nurse practitioner. I'm not a dietitian. I'm not a nutritionist. I have no medical training whatsoever. This video, nor any of the videos on this channel, none of them are to be taken as medical advice. They're videos by a guy on YouTube. If you're going to get medical advice, if you have a medical question or a medical concern, you should seek the advice and counsel of somebody with a medical degree and a medical license. I'm not such a person. Common nutritional deficiencies in children: iron. If left untreated, iron deficiency can have irreversible effects on neurotransmitters, affecting cognitive, motor, and social emotional function. In short term, now ask yourself this: when you take your kid to the psychologist or the school psychiatrist or the guidance counselor or whoever is presuming that your child or children, or you yourself when you were a child, had emotional issues, did they check your ferritin level? Did they check your blood iron? Probably not. So if gone untreated, it has irreversible effects on neurotransmitters affecting cognitive, motor, and social and emotional function. In the short term, iron deficiency can cause kids to look pale, be moody or tired, and feel dizzy or lightheaded. How many people, when they were younger, noticed that the kids that acted the craziest looked the most sickly? Okay? Magnesium deficiency is common in children, especially those who are diagnosed with ADD or ADHD. So keep that in mind. Magnesium deficiency is common in children, especially those diagnosed with ADD or ADHD. Okay, studies on kids with ADD and ADHD. So what it can do is it can cause loss of appetite, muscle cramps, tension, fatigue, nausea, picky. It can make you into a picky eater, particularly as magnesium is found in picky eaters are particularly at risk, as magnesium is found in brown bread, kale, spinach, fish, and nuts. So keep that in mind. Picky eaters are particularly at risk of magnesium deficiency because of where it's found in brown bread, kale, spinach, fish, and nuts. Okay, so studies on kids with ADHD and magnesium deficiency reveal that after supplementing with magnesium and B6 for 2 to 6 months, their symptoms improve dramatically. 2/3 of those with physical symptoms like muscle tension resolved their physical symptoms, while behaviors like inattention, aggression, hyperactivity, and impulsivity normalized by 75%. Now imagine if they adjusted the diet beyond simply adding some magnesium. What if they took all refined foods out of the diet, etc.? Zinc. Signs of zinc deficiency in children include poor appetite and growth and persistent colds. In terms of their behavior, this deficiency can lead to emotional instability, anxiety, aggression, and irritability. So zinc deficiency can lead to emotional instability, anxiety, aggression, and irritability. The bodies of zinc deficient kids are also less responsive to medications, including stimulants that treat ADHD, and essential fatty acid supplementation. Treating zinc deficiency can help repair your kid's immunity while balancing behavioral issues and stimulating their appetite and growth. Multivitamins, nutrients like A, C, D, and E, as well as B complex, are essential for brain development and immunity building during childhood. Deficiencies in these areas can cause a range of behavioral issues. Vitamin D deficiency can increase impulsivity, rule breaking, and aggression, what's known as oppositional defiant disorder. Lack of vitamin C can cause fatigue and weakness. Depression, fibromyalgia. B complex deficiencies can delay mental development, cause irritability, and anxiety. Another side effect of deficiency is reduced antioxidant levels. This increases oxidative stress, which is a contributing factor for conditions like autism and ADHD. Essential fatty acids. Fat makes up 60% of your brain's weight. These fats are mainly omega-3 and omega-6. Deficiencies in omega-3s can manifest as eczema, asthma, poor immunity, and behavioral issues like aggression. Low levels of omega-3 are also common in kids with ADHD, and studies have shown that supplementation reduces hyperactivity, impulsivity, and poor focus. Omega-3 fatty acids help improve brain function and mood in kids. If your little one refuses to eat fish, supplementing with a quality fish oil is an easy alternative. The role of early nutritional deficiencies in the development of psychopathology. Lack of adequate nutrition is a serious public health concern in both developing and developed countries. In developing countries, this condition usually takes the form of generalized malnutrition. In developed countries, strict micronutrient deficiencies are more common. Early nutritional deficits are associated with disturbances in cognitive development and to the latter development of psychopathology. So what it does is it causes poor cognitive development early on, and it causes the development of psychopathology, meaning what would be called psychiatric symptoms later on in life. Following a brief historic overviews, the authors of this thing here present a review of studies directly linking early malnutrition to later development of various types of psychopathology, including schizophrenia spectrum disorders, antisocial behavior, and other externalizing disorders, substance use disorders, and internalizing disorders such as depression. To provide wider context, the discussion progresses to a review of the effects of early malnutrition on cognitive development, surveying both human and animal studies. Dietary and metabolic risks of neuropsychiatric disorders. Insights from animal models. Okay, so this is an abstract here. Neuropsychiatric disorders are major causes of the global burden of diseases, frequently co-occurring with multiple comorbidities, especially obesity. So they co-occur, meaning they happen with type 2 diabetes, obesity, non-fatty alcoholic liver disease and its various risk factors in the metabolic syndrome. While the determining factors of neuropsychiatric disorders are complex, recent studies have shown that there is a strong link between diet, metabolic state, and neuropsychiatric disorders, including anxiety and depression. There is no doubt that rodent models are of great value for preclinical research. Therefore, this article focuses on rodent model of chronic consumption of a high-fat diet and or the addition of a certain amount of cholesterol or sugar, meanwhile surmising the pattern of diet that induces anxiety, depression-like behavior, and the underlying mechanism. They highlight how dietary metabolic risk influences neuropsychiatric behavior in animals. A high-fat diet and or the addition of a certain amount of cholesterol or sugar induces neuropsychiatric disorders in rats and mice. A high-fat diet and or addition of a certain amount of cholesterol or sugar exacerbates the neuropsychiatric disorders observed in animal models of depression. The mechanisms by which diet induces anxiety, depressive-like behavior may involve neuroinflammation, neurotransmitters, neuromodulators, neurotropines, and the gut-brain axis. Further research should be focused on identifying the contribution of diet and diet-induced metabolic risk to psychiatric disorders, which can serve as a basis for future clinical dietary interventions strategies for neuropsychiatric disorders. A number of studies support the idea that a high-fat diet-induced neuropsychiatric disorders may be related to inflammatory responses in the brain, referred to as neuroinflammation, and to peripheral inflammatory responses to animal models examining blah, blah, blah. Okay. In addition, obesity drives senescence, so it kills glial cells in the lateral ventricle of mouse brains, and clearing senescent cells of high-fat diet fed or leptin receptor deficient obese mice restores neurogenesis. So treatment with senolytics, meaning anti-aging drugs, helps to restore pre-anxiety behavior, neurotransmitters and neuromodulation. Diet exacerbates neuropsychiatric disorders observed in animal models of depression. Some literature supports that not only does diet induce or increase the risk of anxiety and depression-like behavior, but more importantly, it may also aggravate anxiety and depression-like behavior in rodent models of neuropsychiatric disorders. Chronic social defeat stress paradigm-induced depression model. The chronic social defeat stress paradigm induces depression by repeatedly exposing naive mice to aggressor mice after 7 to 15 days. In this emotionally stressful environment, mice display robust depressive phenotypes, which are characteristic of human symptoms. Chronic unpredictable mild stress-induced depression model. This just goes over different ways that they induce the states, the mental health issues in the mice. Conclusions. The association between the development of metabolic disorders and chronic consumption of a high-fat diet has been well demonstrated. Interestingly, emerging evidence indicates that a high-fat and metabolic risk are also associated with an increased risk of neuropsychiatric disorders, including anxiety and depression, in humans and in animals. A high-fat diet and or the addition of a certain amount of cholesterol or sugar can induce anxiety or depression-like behaviors, which may vary based on the diet exposure period, the sex of the animal, the age of the animal or human, the species, and the genetic background of the animals used. In addition, diet significantly aggravates anxiety or depressive-like symptoms in animal models of neuropsychiatric disorders. The effects of the high-fat diet on anxiety are critically linked to the duration of the high-fat diet exposure. Prolonged exposure to high-fat diet promotes anxiety and depression in animals that are susceptible to high-fat diet-induced metabolic disorders, and diets with a high-fat percentage may accelerate the progression of this relationship in animal models of depression. In addition, there are significant sex differences in anxiety-like behaviors induced by a high-fat diet and or addition of certain amount of cholesterol or sugar. However, there have been a very limited number of studies involving female mice, and the direction of the sex differences in any individual behavioral test has not been well described. Future studies should investigate the extensive contributions of sex to neurobehavioral outcomes. It is not clear how diet affects anxiety and depressive-related behaviors, while the strong foundation of the literature supports continued investigation of the mechanisms of diet-induced neuropsychiatric behavior. In addition to diet, metabolic conditions can increase the risk of neuropsychiatric diseases. So this correlates to a total lifestyle intervention here. So to date, most studies have used rodent models, yielding some interesting results. The mechanisms by which diet induces anxiety, depressive-like behavior may involve neuroinflammation, neurotransmitters, neuromodulators, okay. Acknowledgements, okay, moving on here. Saturated fat increases the risk of psychopathology, study suggests. Okay, adolescent rats who consume a diet high in saturated fat are at an increased risk of psychopathology in adulthood. The teen years are a very critical time for the brain maturation, including how well we'll cope with stress. Okay, the study let's just skip to the end here. Okay. The findings of the study have implications for stress management and in general mental health, not only for obese individuals, but for individuals that were obese and overweight early in life. The findings of poor threat safety discrimination in our model might reflect either enhanced fear generalization or a more global deficit in associative learning. Disruptions in fear conditioning might represent a mechanism underlying the development of stress-related psychopathology in obese individuals. Their study supports that lifestyle choices during adolescence, including diet, have long-term impact on mental health, considering that childhood, adolescent obesity is linked to stress-related psychopathology. A scenario thus emerges in which a dramatic increase in the level of mental and conduct disorders could emerge in the next few years. Okay, there is an unmet need to identify molecular mechanisms connecting nutrition, stress, and mental health. Very little is known, unfortunately, about this. That's not really true. There's a lot known. It's just not explored. That'll be all for this video. I'll continue with my next video, probably later today.